Hello, and welcome to our latest LGIU interview, where we sit down with local government leaders, chief executives, and experts worldwide to gain valuable insights into the sector. Today, we're talking to Phil Holmes, the president of the Association of Directors of Adult Social Services, ADASS. Phil has been a director of Adult Social Services for 11 years in 2 different councils and has had 2 spells as ADASS regional chair for Yorkshire and the Humber. He is the Executive Director of Adults, Wellbeing and Culture for the City of Doncaster Council, as well as being a qualified social worker and having a strong passion for social justice. Welcome, Phil, and thank you for joining us.
No, thank you for having me.
So I want to first say congratulations on becoming the new president of ADASS. In your inaugural speech, which we'll link in the show notes for anyone who wants to see it, you spoke about bringing rage to your presidency, a rage against injustice. What injustices do you see in the system, and therefore what do you hope to achieve in the next 12 months?
Yeah, the rage comment was funny because it was in as a bit of a joke. Because my predecessor, Jess McGregor, the director in Camden, used a kind of mantra called "to act is to love." So focusing on action, but that action coming from a kind of a place about bringing people together. So I made a joke about maybe I should be the president of rage. But what I ended up saying in the speech was connecting people, building bridges, working in that way was the only way to go. But, do you know, it has stuck a bit, the rage thing, because it got a bit misreported in one of the trade journals. And it's not unhelpful to me that people understand that kind of motivation around social justice, because I think what that does is help us tell a different story of adult social care. So I think maybe nationally, or the public think about it maybe as assessments and waiting times and care arrangements. And actually what it is about making sure that people who might need care and support from whatever age they are in their life, because we know that people who are young people with special educational needs and disabilities, preparing for adulthood, through to the very oldest people in our society, they all have human rights. They all have hopes and dreams that shouldn't be extinguished by a medical condition or a disability or any kind of problem. And reminding ourselves that that's what we're there to do, and recognizing that there's still plenty of injustice around to address in a world where people are pretty angry, aren't they, about being left behind. So it's not an unhelpful dynamic, but I'm really not the president of rage. But harnessing a bit of impatience and a bit of determination to make things as right as they can be in my kind of year of office is definitely motivating.
Yeah, definitely. And where do you see that motivation leading over the next 12 months? What are your biggest aims, would you say?
So for me, it's about trying to work in the right way as president. So again, just inheriting some of the ways that Jess worked as my predecessor, there's probably 3 things that feel really important for me, making good on the progress that Jess has made and also our many predecessors. So the first thing is getting out and about, connecting with adult social care up and down the country. Because if I'm just in kind of a policy bubble, or I currently work in Doncaster. I've been there for 7 years. I previously worked in Sheffield, and before that in Derby, and then in some London authorities. But if I'm just speaking from the basis of my experience in Doncaster now, or my historical experience in other places, I'm not really providing a massively helpful lens. If I'm connecting with practice up and down the country, then I'm representing a great breadth of experience. My first priority is to get on my bike, get up and down the country, and see adult social care working well in different places, and also see some of the barriers that it's experiencing in different places. The second priority is there's so much change going on at the moment, and I think good change, on the whole good change, but everything happening all at once across different areas of kind of government reform. So my second priority is to be a good ally to that change and help it land constructively, ensure that nationally people aren't throwing any babies out with the bathwater, and they're kind of telling a story that makes sense, because often it feels to people like there's so much change they don't know whether they're coming or going, and they need a narrative to kind of land things well. And then the third thing, which probably connects a bit, is just to tell a clearer story of adult social care. So I won't repeat what I said earlier, but it's people understanding that adult social care is how we want to live and how we want other people to live. It's the caring responsibilities that we might have. It's the aging that we will experience. It's also the people that we see around us living with disability, some things that are visible and some things that are invisible. And thinking, why shouldn't they have the same opportunities that I have? So telling that clearer story, which is something that ADASS have been doing through our Care Can't Wait campaign, which is using people drawing on care and support to tell their own story about what's working well, and kind of not making everything into a catastrophe, but showing that good adult social care is happening up and down the country. The failure is that we need the support to make it happen everywhere all at once. So the good practice isn't just spotted around in different places, but it's something that everyone experiences everywhere.
That's a really useful sort of frame. I want to come a bit back to the second point you were talking about with the sort of change and the pace of change. I'm just wondering, because you started as a qualified social worker, and as you mentioned, you've been in lots of different local authorities, what sort of changes are you thinking of there over the last decade? And what, on the other hand, has stayed the same?
So I think the biggest bit of positive change over, well, slightly longer than the last decade would be the Care Act. The Care Act bringing together adult social care legislation in a clear way, but also beginning with key principles around human rights and prevention and inclusion. You don't meet people working in adult social care who would say, we need to rip up and start again, or the fundamental statutory basis of adult social care is wrong. But what people will say, and I think that's the challenge of the Care Act hasn't by itself kind of magicked up a new way of doing adult social care. And some of the methods and the orthodoxies that maybe the Care Act was trying to get away from are still there and is still quite strong. So the idea, I think, that the Care Act was about how can I start with the person? How can I start with the environment that they're in, the assets, the strengths that they bring? How can I build my kind of statutory responsibilities off the top of that? But quite a lot of what we've inherited, probably, going back way further, before I was a social worker, say the Community Care Act, was that 1990? Probably almost a factory model of adult social care. I'm just going to assess you. I'm going to see whether they're eligible or not. If you're not eligible, I'm going to hold you at arm's length. Councils don't just do that. Councils connect really well with their communities, what's going on, and are kind of building that up. But it still feels like the dominant kind of orthodoxy is this kind of gatekeeping, and also in the context of councils having lost a lot of resource all through those years of austerity. There's still something fundamental about the Care Act being there, but it could still feel more alive in the way that adult social care is experienced by people. Quite a lot of that is around the experience of austerity that councils have had, and maybe how they've retrenched a bit off the back of that. And, all the hollowing out of councils that we've heard about. So a lot of the preventative services, a lot of the kind of infrastructure in communities, maybe not being there in a number of councils in the way that it would have been when the Care Act was first envisaged. So yeah, you kind of see that journey. But there's quite a lot of variation as well. So what I'm really not seeking to do is paint all councils as the same. Councils today especially are facing a different range of issues, and they're not all exposed to the same degree of challenge. Some are looking headlong down local government reorganisation. Some have had elections in May that have significantly changed politics and the people that they're working with. So there's quite a lot of variation that councils are dealing with. So those kind of general challenges we've all got are very differently experienced in different places. What I would say, though, and I'm really glad Baroness Casey has been so strong in saying this, local government is the place to do adult social care, because adult social care starts with what do people need to live a good life. It doesn't start with what medical treatment do they need in the NHS. It starts with how do I get out and about? What does my environment give me in terms of opportunities? How is my local economy flourishing? Adult social care sits on top of that. And if it connects well in with that through local authorities, then it can still do okay. But if it turns into a treatment service, a safety net treatment service, like we might experience in other parts of the NHS, then it's probably missing a lot of opportunities.
I think that's a really useful place to sort of start to think about the Casey report a bit more generally. So you've mentioned there one of the principles that you think has correctly been identified in the report of the centrality of local government in the delivery of adult social care. What are your hopes for what the report can receive more broadly, and what other principles would you consider when considering reforming social care?
Baroness Casey is clearly exactly the right person to be leading the commission, and I think she's correctly identified that the public needs a kind of clearer conversation about adult social care and what it means. And I think she's framed it in similar ways that I have. It was what are your rights? What rights should you have? What responsibilities should you have? What is living and aging? What should it be like? How do we define fairness? What contribution should we make in our own lives? And I think what I like what she's done is that she's tried to take a lens that's accessible for people around to start to look into adult social care. So she's talked about dementia, and she's talked about the experiences of people living well and not so well with dementia. That enables people to see adult social care in that way, but it also enables people to see adult social care alongside the health system in that way. So I think that's been really helpful. And she's done the same with motor neurone disease. I think what she'll want to avoid is what I hope she'll want to avoid is adult social care being perceived as just a response to a set of medical conditions. So they're a really good way in for people to understand, okay, I can relate to MND. I've seen, Rob Burrows' kind of heroic story and how Kevin Sinfield's, kind of keeping that going, and other sportsmen and high profile people. People are aware of the dementia and they're aware of its impacts. People are aware of other things like caring responsibilities and so on. So I think the way in to those things is really helpful. I suspect she'll want to avoid a medicalized definition of adult social care, because many people that we support are not about they fit a particular medical diagnosis and therefore it's some prescription that we're giving them because they meet a particular diagnosis. And I suppose the cliche would be, if you've met one person living with dementia, you've met one person living with dementia. So the focus of adult social care is on individual dignity and the strengths that individual people have. And being informed by a condition is helpful, but actually what people are bringing is their own strengths, their own assets, the people around them, their own kind of spirit, you might say. So we're not seeking to try and put them in boxes via diagnosis. So I think that feels like an important area to make sure that we get right. I feel pretty hopeful. I feel like Baroness Casey is morally driven, and she's able to describe issues in a way that resonate with the general public, but also that she brings high challenge as well as high support. So I don't expect her to blindly defend local government as always marvellous. There's a whole bunch of stuff that we know, even without new money, that we could probably improve on. So, she'll bring that objectivity. That means that we've got more chance of meaningful change happening. Feels like a good time, actually, to be the president of ADASS when these things are starting to land.
Yeah, that's perfect. Well, to stay on the optimistic note for as long as we can, what other opportunities do you see that local governments have now in terms of delivering adult social care?
I think local government needs to lean in strongly to this NHS-driven agenda called neighbourhood health. It does feel like the neighbourhood health agenda is NHS-driven and probably particularly hospital-driven. And I've heard NHS colleagues say, well, hold on, it's a really permissive framework, actually. Local areas can get together and make sense of what matters to them, and we're doing nothing to stop that. I think that's theoretically true, but actually all the metrics, the high-level measures that are set out as arbiters of success are NHS measures, and specifically measures about protecting hospitals. So I think that's problematic, but the job for local government and adult social care within government is to step into that space. And I think the opportunity and the challenge is around our health and wellbeing boards and the role that they are expected to have. And I think we need to think as local government about how health and wellbeing boards turn into, and there will be variation, there will be great health and wellbeing boards up and down the country. But there might be some as well that are kind of moribund committees that people they kind of feel very technical, and that people don't really see them as a compelling place to have a public conversation about what good health and care should mean, the difference that it should make. So I think because within the health bill, where the various bits of local government influence on the NHS have been watered down, and we're feeling a bit challenged, feeling like that needs to be challenged in terms of the role of local government, for example, on integrated care boards, at the same time as pushing for the government not to throw that baby out with the bathwater. I do think we need to make sure we rise to the challenge about health and wellbeing boards being everything that they should be, because I think a member of the public would see that as the place where there should be public accountability for health and care working together, making a difference in the interests of local population and the voice of local people coming through in those spaces, as well as it should do, by the way, an overview and scrutiny mechanisms. So I think there are opportunities for local government to think about the mechanisms that we've got. And also I suppose what I'd see as a retrograde step around Healthwatch being abolished, or Health Watches being abolished. What space do we need to get ourselves into in local government around commissioning the voice of local people, especially around social care and associated services? Because if we're not directly listening to people who have the experience of care and support, we're going to be commissioning the wrong things, doing things in our own bubble, things that don't make sense.
And that's really useful. And your focus on neighborhoods there in the beginning of your answer has brought me on to something else that I wanted to ask about, which is, so we also have substantial reforms to children's services across social care and SEND, and significant reforms to integrated care boards. We see reforms to police, reforms across the public sector and the NHS. As president of ADASS, where do you see the opportunities between all of these changes? And how would you want to join up the dots between them?
So we do periodically meet. So I think the first meeting's coming up. So myself, the president of the Association of Directors of Children's Services, the president of the Association of Directors of Public Health, and the place directors in councils who have a massively important role in that prevention space, by the way, in terms of that kind of infrastructure that actually often children's social care and adult social care costs eat away at the infrastructure in councils to help people live good lives. So us connecting and being in that space is important. And actually, the previous Secretary of State in the Department of Health and Social Care, we ended up having written to him about health reforms in a meeting, all of us together, and it was really helpful for us. And I think it was helpful for him to see that local government could talk with one voice across a range of health and care issues. Got a new Secretary of State at the moment. We don't know what the state of the government will be in a few weeks' time. But I think with the new Secretary of State, we need to try and cement some of those relationships. I like to be in adult social care, maybe more than I would like to be a DCS, or I'd like to be maybe someone who works in an ICB, because I think there's a lot of command and control in those environments, say from Ofsted, say from NHS England, or those kind of health orthodoxies. And I think that can be a real problem in terms of effective working that makes sense, because people feel so strongly mandated by regulators or by kind of command structures that they find it hard to do the right thing in terms of collaboration. So I think we need to try and push at that. I feel like the Care Quality Commission regulation of adult social care is pretty enlightened and permissive, is holding us to account around maintaining good standards. Having that assessment framework has been helpful, and phase 2, I think, will get even more helpful as they kind of fine-tune their kind of orthodoxy. But there's no perverse incentives to do the wrong thing in the kind of CQC arrangement. So I think that can sometimes get in the way of joint working with some other professions. But the individuals in those leadership roles are people that feel that they're easy to work with. We can put up a united front without it looking forced. We've got the same motivations around people's rights and kind of good outcomes and evidence-driven practice, whatever the age of people and whatever their background. So I think we need to do a bit more in that space because we've got a lot in common.
That's useful. And I think it touches on the level of change going on in the institutions across different parts of local government. So I'll just come back to something that you said a little bit earlier about some councils are facing local government reorganisation. I was just wondering, in your view, as the president of ADASS, what impact does the wider local government reforms, and there I'm talking about reorganisation and devolution, what impact do they have on the adult services across the country?
I mean, there's devil in the detail, right? So I don't want to get right into the detail of, a particular county puts a submission in and it comes back and it's completely different. And I don't want to get into the detail of that. All parts of this reform agenda make sense as individual parts. The theory behind them is sound. It's hard to argue that they aren't things that should be done and will be helpful. There's a lot of devil in the detail around implementation and some of the feelings about goalposts moving that I think are really challenging for councils on the ground that are embroiled in particular issues. And there's a sense that they consume a great deal of bandwidth in relation to managing the change. But the thing for us to to try and do as a point of principle, I think, is hold our nerve on kind of navigating through that period of time and trying to give the government of the day as, strong challenge, but also strong support where we can so that things do land without there being kind of perverse outcomes. There's something about it all needing to make sense to people. So I think what I perceive from national government is that they sometimes see local government objecting to everything while saying that everything can't stay as it is. So I think we can't be in that pattern. If I was embroiled in a particular local authority at the moment that was facing the sharp end of local government reorganisation and feeling like things felt very different from how they were presented a year or two ago and, having to consume all of that, I might have a very different perspective just because I was so involved in it personally. But seeing it as a whole, you see it as a logical set of things to happen. How can we manage the implementation? How can we get the balance right? And how can we help people see their way through this period? But what it does mean for adult social care in terms of reform is that the people working on these areas are not going to have much bandwidth for other aspects of reform. The other thing that it means, the very practical thing that it means that we're talking to ministers about, is we've already got an issue with investment in a pipeline of directors of adult social services, a pipeline of principal social workers, of principal OTs, of key roles that each new unitary council will need. We've already got an issue with that because there is investment from DfE, for example, in children's that we do not have in adults from government departments. So that is only going to magnify the risk for national government for new councils standing up without good quality, supported, developed DASS's, principal social workers and so on. So for me and from an adult social care perspective, it's really important that they take the opportunity to invest in the pipeline of leaders that these new councils will need, because there are going to be more unitary councils. Although there'll be less councils overall, there'll be more councils with social services responsibilities, and we can't magic these leaders out of thin air. So we really need focused attention on that. And as I say, in some ways, in terms of the differential approach, DfE have helpfully backed DCS development. We've probably not had that experience from a ADASS perspective, and it's overdue now, and it'll get business critical if it's not invested in.
So we've focused we've referenced a couple of times throughout the conversation the funding question, and I think it's worth just directly addressing that. So I was just wondering, in your view, what do you believe a sustainable and equitable funding settlement for adult social care should look like? An easy question, obviously.
Well, that's so straightforward. I think the first thing I'd say is that it's manifestly wrong for adult social care to be propped up by social care precept that's added to the council tax base. We already know that council tax is an inequitable way of raising local revenue. So the idea of layering a social care precept on top of that is unhelpful of itself. And it also runs contrary to the national government flow about the idea of a national care service. So that's a whole other conversation. You might want to unpack that. But if you're talking about a national care service, one of your fundamentals ought to be that each constituent geography, each council, has sufficient, transparent funding to reasonably make a fist of it in their area. And anything that's dependent on local council tax raising, obviously alongside as well the local politics that go along with that, especially in the current volatile climate, we're setting adult social care up to fail. So every year we don't address that, we are leaving councils further and further short. It's a little bit disingenuous, isn't it, that we've given the councils this amount of money, asterisk, if they max out on council tax. So we need to make sure that adult social care addresses that. I've seen some thinking that says, from the Fabian Society, that says that there should be pretty much a ring-fenced allocation of adult social care funding for councils that explicitly relates to evidence need in that area. And then it's reasonable then to performance manage the council against that amount and the outcomes that it delivers. And there's definitely devil in that detail, but it's a much more transparent position than the one we have at the moment. And we know at the moment in every council, people aren't quite clear about adult social care, the national context, hence the Casey Commission. People are super clear about potholes, though. They're super clear about when their bins are going to be collected. And they see that area of council activity being eaten away at by increased children's and adult social care spend that's kind of being raised locally. That just doesn't feel sustainable.
So to move from decisions made by the national government to things that councils can do, I was just wondering, where and how do you think councils across England can learn from each other? And if we move even wider, do you think there's any lessons that English councils can learn from international council best practice?
ADASS are a charity, but we're also a member organisation. So 153 councils up and down the country in England, and there'll probably be more with local government reorganisation. And probably one thing that will, kind of annoy people with looking at things nationally will be, well, why is there so much variation in the sense of something that manifestly works over here is not being practiced over there? And there are local variations that are understandable in terms of local conditions and local strengths. So you don't want one size fits all adult social care. And that's probably something else that the Casey Commission should watch out for. Kind of prescriptions that look logical on paper, but actually will strangle some of the innovation and some of the individual strengths in individual councils, getting the balance between that and an appropriate level of consistency. So the job of ADASS, alongside other organisations, like say the Social Care Institute for Excellence, Skills for Care, having a look across our councils, having a look across practice, across providers as well, and saying, how has this area made this particular area work? What are the lessons? It's not just lifting and shifting it or a PowerPoint presentation that's all magically doing it, but what were the lessons of implementation? How did they get to kind of where they were? How did they get to where they got to? Well, the one thing that I have picked up from really good practice, so some of the good examples are, say, Wigan, best CQC rating in the country, known really well for the Wigan deal going back a few years. Barking and Dagenham, we're just hearing out some really good work from Barking and Dagenham around neighbourhood health, which is based on kind of authentic relationships in communities. We've been hearing kind of really good feedback about hospital discharge as well in the West Midlands. And all of those areas, the success factor has been good local relationships that have gone back a number of years. So it's not the magical, wow, I've seen the project plan, I'm just going to replicate that and get it done next year because the budget saving says I've got to do that. The success is around the right people with the right values in health and care working together over a number of years. And when I went to Wigan to visit a good few years ago about the Wigan deal, and I said, what's the best way of getting to where you are? And they said, well, start 8 years ago. So there's something about understanding that we have to lay the conditions for long-term relationships rather than all this flurrying about. So it's values-driven, authentic leadership, connecting with local people, being driven by a good life for them, having partners with the same approaches. That's what's given us those sort of successful examples up and down the country. It's not kind of implementation via project plan. So I think that angle is really important. And ADASS, and as me saying earlier about me getting up and down the country, is part of that, part of telling that story. And I think ADASS as well has hugely strengthened its approach around international research. I still think it's relatively early days for us demonstrating an impact from that. It's really easy to go abroad and go, well, look at that amazing outcome in that system, and then realise that a lot of the conditions are not particularly transferable to the English system. But we're really upping our game, I think, in ADASS around, we've got a specific research network with some brilliant leadership and good people engaged with it, connections with universities, and we're connecting that with some of the international work that's had consistent leadership for a while in terms of international research. So I don't think there's any glib answers, but I think ADASS, in terms of national evidence and in terms of international evidence, are starting to get into a stronger position to put it together.
Brilliant. Thank you. Phil, I want to thank you again so much for your time today and for sharing your insights with LGIU. And thank you to everybody for listening, and stay tuned for more LGIU interviews.